So I am Peg O'Connell, and I am very happy to be here. I was the founding board chair and board member of North Carolina, of Prevention Partners, and I am the immediate past chair. Very glad that Greg is now in charge. He at least remembers the name. It is very exciting to see how Prevention Partners has evolved. I was sitting with my former colleague, Bob Weiser, and I think I dragged Bob to the very first annual meeting. So, Bob, welcome back. The food is better, and the location is nicer, and we have a few more friends. Healthy places change lives. That's what we say at Prevention Partners. Our focus is on transforming hospitals, schools, and workplaces to make healthy the easy norm. These partners have been working with us for varying amounts of time to get to a place of success. We've brought these panelists here to reflect on how they have built healthy communities, how we have been a partner to them, and the ripple effect of our shared efforts. And just in case you missed it, you will notice on the front of the annual report is the ripple. That's the ripple effect. So let me introduce our panel of distinguished speakers. First, on the far end, please meet Dr. Janet Collins. She directs the Division of Nutrition, Physical Activity, and Obesity at the National Centers for Disease Control and Prevention. She is no stranger to prevention, of course. For 5 years, she directed the National Center for Chronic Disease Prevention and Health Promotion. And as a personal aside, when Dr. Collins was in charge of heart disease and stroke prevention, she provided one of the first bits of funding to the North Carolina Heart Disease and Stroke Prevention Branch, who provided one of the first bits of funding through a contract to North Carolina Prevention Partners. So, Janet, look what you have accomplished. Next, we have Captain and Dr. Joseph McQuade, who serves as Medical Director of Public Health at the Naval Hospital in Jacksonville, Florida. He also coordinates Ambassadors for Health, a hospital initiative with the Department of Defense, focusing on changing worksite food, fitness, and tobacco policies, and practices for base employees and patients. He is also a practicing physician and helps deliver babies and take care of moms and dads and little kids. So welcome, Dr. McQuade. And third, we have all the way from New York City, but by coming from Greenville, North Carolina. So yes, that's right. So you can take the country, the girl out of the country. We welcome Dr. Susan Kansagra, who is Deputy Commissioner of New York City's Department of Health and Mental Hygiene. Under Dr. Kansagra's leadership, the city has implemented programs for healthy eating, active living, and tobacco cessation, as well as the promotion of maternal and infant health and healthier schools. So welcome, Dr. Kansagra. We will have time after the meeting, not after the panel, for you all to ask questions. You'll get some one-on-one time with these folks. So as we move through this, I will ask you not to say anything untoward or leap out of your seat. So, all right, unless you really, really want to. So let's get started. This is a conversation, so please have some give and take with each other, and hopefully you won't make each other mad or anybody, especially you who might have a gun because you're in the Navy. All right, so healthy places change lives. We'll start with Dr. Kansagra. What were your goals in partnering with Prevention Partners, and what were some of your measures of success as you began this journey?
Well, first, let me just start off by saying thank you to Prevention Partners on behalf of all the panelists for having us here. It's a real honor to be here, and really commend you all on the tremendous work that you have done to be engines of change in public health, and we certainly appreciate all the support you have provided in New York City. So going back to the question of our initial goals, our goals focus on population health and measures that measure health across the entire city of New York City. We're a city of 8 million people that's very diverse, and anytime we are implementing a program, we're always caught between the tension of do we want to go broad or do we want to go deep? And with this particular partnership that we've had, we chose to go broad because really to impact change across the city, to create these changes and indicators across population health, we had to make sure we were reaching a wide variety of people, number of people, and diversity as well in who we reached. And so that was really our first decision point in how we focused our measures of success. We chose to partner with hospitals, which we knew were reaching a wide, number of people, both as a large employer, as a large institution that already has health as a mission and reaching so many vendors, patients, visitors. And so Prevention Partners really helped us work with the hospitals in New York City to achieve that point. We also felt it was a good time regulatory-wise. There were a number of changes going on that made it a key time to partner and create some of these tools around tobacco cessation and treatment.
Very good. Dr. McQuade, what started you on this journey, and what were your initial goals?
I'm a family doctor in the Navy, so they came up to me a number of years ago when I was acting as the residency director of a big family medicine residency program, and they said, "You've got the biggest or the most active obesity and tobacco cessation program. We want you to come to this obesity deep dive." So the Assistant Secretary of Defense sat us in a room, and it was sort of like when they pick a new pope. They wouldn't let us out of the room until we came up with our answers. But it was interesting. We all sat around and we talked about how we could start the program. And one of the dietitians, I think, I was working with, they said, hospitals are such unhealthy places to eat at. I wonder if we could come up with a way to make the food better. And from that came up the idea of why not make a healthy hospital assessment, some kind of a checklist. So I went and I traveled to the Cleveland Clinic. I went to Dow Chemical up in Midland, Michigan to sit down with their public health director there. I went to Henry Ford Hospital, and I learned what they had put into place. And all of them, in one way or another, the conversation always came back to, there's a group in North Carolina that you got to sit down with those guys because they have the same goals. Fortunately, the next week I went over to the Centers for Disease Control. I sat down with Dr. Belay and with Janet, and we were able to come up with a plan. And at that sitting, Brooke said to me, "You need to talk to Prevention Partners." DOD-wide, we have 126 military treatment facilities, but we're spread out over the whole world. And nowadays, there's less and less money to travel, so you end up getting stovepiping. Each hospital does its own thing. One hospital may have a great fitness program, another hospital may not. And the fluidity of our staff is incredible. Most doctors only stay 3 years in a hospital, then they rotate to another one. So I was stationed in Naples, Italy for 3 years. I was stationed in Groton, Connecticut for 3 years. And I've been fortunate to have been able to stay in Florida for some time now. But because we have our staff turn over so often, we lose any sense of continuity. And it's so hard to sustain a program when your relief doesn't really like it. I got my own ideas, I'll do it my way. So Prevention Partners is such a good fit for Department of Defense because it applies a structure, it applies metrics, so we can measure each hospital. So Naval Hospital in Naples can be measured next to the Naval Hospital in Yokosuka, Japan, and we could see which one of them is a healthier place based on what is the quality of your food, what kind of physical fitness activities do you have available, and what are the rates of tobacco cessation efforts that are being done at your local place. So it really is such a nice fit for us from the standpoint of being so widely spread around the world and having such a fluid staffing that it makes it almost impossible to run any program for more than a couple of years, and then it dies. So it's a great fit for us, DOD-wise.
Very good. Dr. Collins, you were prevention before prevention was cool. So
I'm feeling really old.
No, I know. Just yes, when you were in the third grade, you started. The Centers for Disease Control and Prevention. What were some of your initial goals, and how did you come to be on this podium and be part of the Ripple?
Well, thank you so much. It's wonderful to see all the incredible leaders engaged in this effort and to join such wonderful panelists up here. We just really love the work that Prevention Partners is doing. It's a perfect match to our place-based approach to influencing public health on a very broad scale. But the real excitement is seeing you guys make it happen on the ground and having those very concrete and practical models that we could say around the country. This can be done because it has been done. So we're particularly interested in from a place-based model in hospitals. And it may be very obvious why we are. But when we look at the successes in tobacco control, you really notice that you have to create a social movement. It was very hard to create a tobacco movement when we had physicians smoking cigarettes in the halls of the hospitals. And likewise, it's going to be very hard to develop a social movement in this country for healthy food environments if our hospitals aren't the ideal locations of representing healthy foods and beverages. So we have an eye on this, not only because of the reach of the hospital as a work site and a community center, but we have an eye on this because it's hard to imagine that a location like a hospital, which is responsible solely for the restoration of health, isn't looked to as, well, if these foods and beverages are here, surely they're fine for my health. So if we can get hospitals to be out in front, leading the way, making these changes, we really feel that that can be a community driver for an enormous number of settings. We look at the data that 100 million people a day are served in institutional settings. By institutional, I mean preschools and schools and colleges and work sites. There's tremendous reach in these institutions through the food service provision, and you guys are showing the way in terms of hospitals, which we feel are a critical setting.
Very good. Very good. Well, and on that note, just as a point of bragging for North Carolina and Melva, wherever you are, Melva, North Carolina is the first state in the union to take every single one of its hospitals tobacco-free, and that. And Dr. Kansagra, for somebody from Greenville, you know that was not easy. So. Wonderful work, wonderful work. All right, Dr. Collins, if you don't mind, I'll just follow up. As far as the work that's been done so far in the hospital setting and in other institutional settings, what are some of your points of pride? And then maybe some of the surprises that you got, some maybe good surprises, maybe not so good surprises, but if you had to write a couple of sentences, what would you say?
Sure. Well, one of our decided points of pride, which is why several of us are here, is our partnership with Prevention Partners and the work that you've done. I think that proof of principle, not only in North Carolina but beyond, is absolutely critical. So CDC is a very proud partner, very proud to have been party to the development of this work. And I think, the thing of greatest pride, perhaps, is that it's actually happening on the ground. You guys have over 200 hospitals in multiple states, not only joining, but continuing to improve as they partner with you. And, and I think in North Carolina, really a proof of principle of a social movement so that it becomes energy of itself when you get that kind of engagement. So we would love to see what you're doing in North Carolina and beyond be as robust across the country.
Very good, very good. Well, we would love that too. Dr. McQuade, since you're in the middle.
Yeah, what I like is when I walk down the hallways of the hospital, if someone is eating a Philly cheesesteak or something, carrying it back to their office, they'll cover it up and hide it from me. And it used to get me a little upset. Now I realize that's good. I really do like that they realize that we're opening the door to discussion and we're creating a cultural change in the military. You would think the Navy, the military everyone must be in great shape. Completely untrue. We have a very urgent problem within the military because there are fewer young people who are eligible to join the military now, to start to even enlist in the military. And once in the military, we waive about a quarter of the staff doesn't have to do the physical fitness test every year because they've got this problem, this problem. So it's a very, very looming big problem. One of, I think, the greatest successes that we've had is that we're at least opening the door now, and it's open for discussion. Assistant Secretary of Defense for Health Affairs looked me in the eye and said, Joe, this program is a big one. We really want to get this on the road. And what's amazing is how much inertia has to be overcome to change the way people think about the way they eat, and they get very emotional about it. I've had, nasty notes left on my desk. We have an eating place, I don't want to call it a restaurant, inside of our hospital where they were selling chicken gizzards. And I just went ballistic one day, and I said, I want the chicken gizzards off the menu. At the very least, don't sell chicken gizzards to the patients. I'm stuffing statin drugs down people's throats, and now they go over here, they could eat the chicken gizzards. They're full of liver that has so much cholesterol. So they removed the chicken gizzards for me, and I would have thought no one would notice. I got hate mail for about a month. But now at least we've opened up the door. People will talk to me about, Dr. McQuade, why don't we have a walking trail around the hospital? It's a great idea. I'll put that into place. Dr. McQuade, how is the bike share program going? We're trying to get a bike share built onto the base, and we're in active communications with a farmer out in town to set up a farmer's market right outside the doors of our hospital. So we have a lot of great programs that are now, they're on the table. Have we succeeded? I can never say we're even close. But when I look back on the years back, and I think, when I was a resident here at the hospital, it was even worse than we are now. So we are making some progress. But it's a long journey. Mm-hmm. And I loved when I talked to Annie about the program once. She said, Dr. Joe, it may take 10 years before you'll feel that feeling of success. I went to Rex Hospital and I saw the great work they were doing there, and I said, wow, this is incredible. He says, they've been at it for a number of years, mm-hmm. So it does take time.
Very good. So do you have people like at Rex that come in off the street to eat in the healthy, delicious cafeterias at your hospital yet?
At my hospital?
No. All right, I'm sorry, that was mean. Dr. Kansagra, points of pride from New York City.
Sure. I think one of our points of pride was that we were able to work with a really diverse range of hospitals in New York City. So we were working with academic medical centers, we were working with smaller community hospitals, and really being able to create a flexible tool that was applicable across the board. Although we had that breadth that I mentioned earlier, we were really able to create depth too, because we found local champions in each hospital that were really willing to take on this effort and this cause. And I think, along with that social cultural norm shift, I think we're seeing that it's no longer acceptable, in these types of environments to promote unhealthy behaviors. We're really starting to see that shift. I remember after Hurricane Sandy, actually, the city provided MREs to a lot of the folks that in the damaged areas, and they're actually higher calorie, and they're designed that way because in certain certain emergency situations you may not have access to food. But I remember when we provided that, there was actually outrage that we were providing higher calorie options, and so I think that by the press, and I think that's really a social and cultural norms change that we've been able to create. That people expect healthy food.
It's about 8,000 calories in it. Am I right?
Oh, I don't think there were that many, but there were high.
Very good. Well, I have to tell you, it's a point of pride for Prevention Partners when people from New York City, is Maria in here, started calling us for advice. You have no idea. We were like, people from New York City call us on the phone here. This is so great. Yes, and what can people from North Carolina teach some people in New York City? So
we learned a lot. And actually, since you mentioned Maria, I did want to actually have her raise her hand. That's Marie Bresnahan, my colleague from New York City, who really, she has been a leading driver of this work in New York City, and really it's because of all of the success that she's had that I'm able to sit up here today. So thanks, Marie.
Very good. So next question. This is never going to be easy. I mean, and it's there's the minute you think you've climbed the mountain, somebody rolls a rock down on top of you. So, Dr. McQuade, I'll start with you. What, other than the chicken gizzards, tell us some of the challenges that you continue to face, and maybe the first obstacle you had to overcome.
Yeah, well, it's a difficult thing to communicate with all these 126 medical treatment facilities spread around the world. So communication is a difficult thing. It's easy to sit and speak with people in a little forum and say, this is how I want to get this point across. But to be able to send marching orders to each hospital, they have to train up each new commanding officer. And the problem is that the military we don't get together anymore. They've gone away with all military traveling. So it's a difficult communications effort, and that's going to remain a big obstacle. But at least it's one that we're able to identify and say, okay, we can work around that a bit. There's a lot of players in the Department of Defense who have been there for years, and they don't want to hear it. They say, well, we've done that before. Why don't you just tell? Someone said to me, why are you letting people ride a bicycle on the base? Because what if they fall off the bicycle? And I looked at him, I said, well, what if they never ride it? What are you talking about? I mean, we've got to open up opportunities for them to exercise more. I own my own bicycle. It's in my garage. So I don't think we should spend money to allow people to ride a bike on the base. So there's a lot of mindset changes that have to occur. And it's a challenge. Military people, sometimes you think you give them an order and they'll do it, and sometimes you're surprised at how you have to really spell it out, because then the new CO, a new XO comes in about every 18 months, and they're going to win their own medals, do it in their own way. So it will be a tremendous challenge for us to line up to say, this is the way it's done. And by prevention partners, when you look at those nice metrics and they're graphed out for you, it really does create that structure. I was saying earlier today that everyone knows what the right answer is, but you have to somebody has to be there with a ruler and smack you on the rear end if you don't do it. And that's
an interesting approach.
And that's, I think it's the big value of prevention partners, to watch us, to know we've created somebody who's consistent, fair, and impartial, and will measure us, and we'll be able to sit there and point to a chart and say, Captain, look at us. We've dropped from first to last. What are we doing? And then it'll continue to push the program along. But communication is a very difficult thing in any organization, but in the military it's particularly hard, especially when there are competing priorities, which there often are.
Very good. Dr. Collins, what about you as far as the challenges? I mean, you literally say, I'm from the federal government and I'm here to help you.
Yeah. Well, obviously the challenges are enormous because we've got hundreds of thousands of locations, whether they be childcare or schools or hospitals, that really need, in many ways, a total reworking of the food and oftentimes activity environment. So, I think some of the challenge is probably going to be helped along by public engagement. We have some, informal data that at least 50% of the workforce says they wish they had healthier choices at work. We get hit as public health, and those of you from local and public health know it well, that somehow we're, fooling with people's lives. We're a nanny state. We don't need to be doing this stuff. So those are definitely some of the challenges that we face. But, in point of fact, not doing anything is a choice, right? I mean, to ignore the quality of the food environment in these locations is a choice. And so, anyway, it's a tremendous challenge. We get some backlash for this. So I think to the extent the public, leaders like yourselves in all kinds of institutions and settings can speak up on this point, as a leader or as just a member of the public who wishes when they, I know all of us daily experience, missed lunch, you go to the vending machine at 2 o'clock because it's the only thing that's available, and it's filled with not so good choices. So even the most motivated of us realize how important these environments are to our ability to make healthy choices. So I guess I'm kind of, hoping for public activation here.
Very good. Well, if the meals ready to eat issue starts to resonate, so it's becoming, when the media starts asking the questions, then that's the first step. And now, Dr. Kansagra, I have to say, I had in my mind when Meg told me that we were going to be working with New York City, all I could think about was you and Maria going around saying, please don't smoke in this hospital, and somebody going, are you talking to me? Or however people say that in New York City. I don't have the best. So challenges. I mean, you've got multiple hospitals. It's New York City.
Sure. So we've had, I think one of our biggest challenges is that we've had no real carrot or stick, or I guess ruler, as you put it, for some of our work. But we really had to create that. So, for example, for the carrot, we've been able to create an award system, bronze, silver, gold, like the Olympics, and really create friendly competition to drive people towards excellence. We've, whenever there's been progress and hospitals have achieved these star status, we are the first to be out there and promoting that and getting as much press attention and media attention for those hospitals. And so that's really helped provide some of the incentive. And, it's tough in this environment. There's a lot of changes to the healthcare delivery system that everybody is grappling with. So it's challenging to get above the clutter. But I think, again, reminding people, as Dr. Collins mentioned, that lack of action is also an action in itself, and really challenging that complacency to, get to the next level and really fulfill the mission that I think everybody is trying to pursue in the end.
Very good. Well, I think the changes that are happening across the healthcare spectrum make everything we try to do a moving target. So I admire you for taking the steps forward. Last question for you all, and then I'll invite you if you have any last-minute thoughts you might want to share. Again, the theme is the ripple effect, and actually the theme of all Prevention Partners' life has been the ripple effect, even though I don't know that we ever actually called it that until recently. But so you are working specifically in a hospital, Dr. McQuade, in Jacksonville, Florida. But you are communicating with people across the world. What ripple effects do you see from what you're doing at your location and your bully pulpit?
So far, the biggest effect, we have a family medicine residency program, and we have 37 residents in our program. So it's a very big residency program. These guys, when they graduate on the 1st of July, they'll be shipped around the world. They end up in Yokosuka, and Naples, and Sicily, and Germany, and they go all over the place. What I love when I get a quick email back, usually in October or November, after they've settled down in a new duty station, now they're practicing physicians, and they email me back and say, Dr. McQuade, you wouldn't believe it. They put me in charge of tobacco cessation. How do I do it? And I love it. I have a little package of information I send out to them. I explain to them the system's approach to care. I explain to them, create a patient registry so you know each month how many people have tried to quit. You could follow them up. Create ease of accessibility to the medications that are available. Create the mindset that even a minute spent talking to someone about tobacco is worth doing. And it's such a nice thing when the residents email me back and tell me, now I'm in charge of the program. I'm realizing how hard it was. How do you do this kind of work? So it's a great thing. The White House doctor right now is one of my old residents, and she emailed me the other day and said, "Hey, I want to start the healthy, a healthy assessment up here at the White House." And I started laughing. I said, "I think they're already doing that." And she said, "Because yeah, but for my staff, I think it's important. How do I do it? How can I sell it easily?" So it's very nice to know that the residents are out there and they're planting the seeds that we had sown.
Very good. Like, if in case you didn't get it, the seeds on those little cards on your table, take those home and plant them. So thank you for giving us a pitch, even though I don't know you knew you were. So the ripple effect from New York City, what are you seeing?
Sure. So we're seeing definitely a ripple effect, and two of the key areas are our hospital association is actually very much now looking for other ways to partner with our health department and other aspects of wellness, and also the unions in New York City. We have a very heavily unionized workforce, and the unions are becoming more and more interested in worksite wellness opportunities, certainly because it affects their members. At the same time, some of the change that we've made in healthy eating environments, we've put in place nutrition standards across all of New York City government that affects about 260 million meals per year, and then we're also doing that in our hospitals, and we're finding more and more we're going up the distribution chain. We're getting large food suppliers actually coming to us and saying, you've made a change here and here, so we want to come talk to you and figure out kind of what you're doing and how we can replicate that in other places, and employers as well.
Very good, very good. Dr. Collins?
Sure, I think I'll just mention some ways that we're trying to create ripple effects as you are as well. The National Prevention Strategy was a strategy framed at the federal level and that now engages 20 cabinet-level agencies, actually agency heads, so transportation, agriculture, justice, and so on. And that cabinet responsible for the National Prevention Strategy has decided that one of its two top priorities will be to do healthy food environments in the federal agencies themselves. So, it just starts, not only, do we feel this responsibility very sincerely at CDC to be representing this for the nation and looking at our own house and the extent to which it's in order, but activating these other agencies, it just sort of sensitizes them to the role of their agency in health, and even broader, the role of transportation and agriculture on health, but starting at least at the federal agency level. We've also put nutrition and tobacco voluntary recommendations in all of our funding announcements so that we encourage state and local public health government to, execute locally within their own agency what we're trying to execute at a national level. So you don't know quite how all these things play out, but I think it's really important for the federal, national, and state and local leadership to be role models of the work.
Very good, very good. We have just a minute for each of you if you'd like to say anything else or anything you might have wanted to say before, either to each other or to the group. If you,
New Yorkers are not rude.
oh, good. All right. Thank you very much.
No, I will just add, through our work on the tobacco-free hospitals work, we've reached over 1 million people in New York City, and we're working with 18 hospitals. We're very proud of that. So thank you again for all of the work.
Very good, very good. Dr. McQuade?
When I was at Georgetown Medical School, this old doctor got up and he said, who in this room is going to do this and that? He went around everyone wanted to be a neurosurgeon and all this fancy stuff. He says, let me tell you something. You'll solve more of the world's problems. If you can get one person a month to quit smoking, you'll help more people than all the great brain surgeons that lined up. And I'm not sure his data is statistically accurate. However,
but we love it.
I never forgot that he had said that. And when we reach out and we maximize the tobacco care, I say within the medical homes that we're building in the Navy, if you could take care of the tobacco, now you've demonstrated to the patient that you care about them and you're trying to help them with something that's very difficult that they're working on. The diabetes aspects of take care for their diabetes gets easier. The compliance with them taking their statin medication and their aspirin a day becomes easier. So it's just it's a momentum that you're building, and if you could just focus on getting the tobacco under control, then a lot of other things fall in place for the patients, and the patients really bond with you. So it's a wonderful thing. I think as a family doctor, I love doing this kind of work, and it has so much benefit for the patient in more than just what meets the eye.
Very good. Dr. Collins, I'll give you the last word.
Oh, well, thank you. It's wonderful to see the leadership in this room, because this is going to play out at a very local level. So, you doing the kind of innovative work that you're doing and see how far you can push forward on healthy food environments and tobacco-free environments. So Just want to really commend Prevention Partners too. We're super excited that you're going, explicitly national, because that certainly is our focus, and we have learned so much and just very much appreciated this partnership.
Thank you. Thank you very much. No matter where we've worked or in what sector, we've found one crucial ingredient for successful change: a passionate leader. One person's energy and conviction ignites another, and the change process takes off. We've seen such passion engage entire organizations, communities, even states, leading to countless healthier lives through prevention. Thank you to our 3 doctors, Dr. Kansagra, Dr. McQuade, and Dr. Collins. What an inspiring group of people. What an inspiring look at prevention efforts underway across the country. Prevention Partners is proud to work with each of your organizations, and we'll look forward to doing more in the future. Thank you very much.